two good flat results is going to be even, adequate compression. You know how sometimes in your faja you get where it's tight here, but loose here, tight around the hips, loose in here? That's because it's not even adequate compression. You also notice sometimes when we talk about bands or when things are too tight, you get that pooling of fluids above and below. It's because it's not even adequate compression. So the way to counter that is you want towels that are like 3 to 4 inches thick. So you're going to find a towel that's extremely soft as possible. You want to avoid textures if you can.
Okay.
If you do get textures, you want to apply that if possible, not on the skin, because remember, anything with binding, ridges, bands, it could leave those indentations as smooth as possible.
Okay.
I would even recommend wearing a camisole underneath, like a small camisole, one size smaller than your norm, so it fits like your skin.
Okay.
You want it to fit like a glove. If you wear one that's too big, it's going to bunch. Any bunching, again, is going to create indentations and vasoconstriction, okay? So you're going to put that as snug as you can. Now keep in mind, you see that even, adequate compression all the way around? Unlike the faja, and then in here, loose here. This is even all the way around. And then you're going to take your abdominal binder. It takes, of course, getting some used to learn to do this on your own. But for me, sometimes I would get the jumbo safety pin and pin the towel in place so that I can maneuver better. Or I just press the front of my body against the wall so that I can utilize my hands. So I can get that as snug as I need to at top. The bottom, even lower or even more snug. Okay. Because I need that snatch.
Right.
Still avoiding my hips. My moo-moo dress, and I'm around my house.
Okay. Yeah, because sometimes you.
Yeah, and you need, you know, like here, it feels loose. Guess what? I could always take this Velcro. You should feel a nice snug, nice good support. You'll feel that support without that constriction where I can't move, can't breathe, it hurts, it's hard. Now, keep in mind, you'll have to get used to the bulk, but it's extremely comfortable. Nothing about this process is comfortable. Would you rather have tight, pinching your skin, or
that?
Okay.
Because last night, ooh-wee.
And when I tell you, anybody I've given this little secret to, when I tell you that belly gets flat quick and it's snatched, as long as you can talk.